Hi, I'm Doug Coldwell. I'm an interventional radiologist and have been for about 25 years. I've been chief of angio at a number of universities and now have my own private practice in Oklahoma. And I've been using the ADCO Ergolite for about the last 10 years. And I just wanted to let people know what a great piece of equipment it is. About 10 years ago, I came upon this little company, ADCO, that makes these Ergolite aprons. Changed my life. I sound like I'm going to Radiation Anonymous, but it really did, because the belt supports my back. There's some things like collar stays that are in the shoulders that keep all the weight off my shoulders and on. It goes onto my hips. It's like the belly band on a pack. So it keeps all the weight distributed to your hips, and because it's two-piece, it's very light, and because of the material it's made from. It has actually helped my back because of the belt. So good radiation protection and helping your back and shoulders by redistributing the weight onto your hips. It's a great piece of equipment, and I swear by it. What you need to be doing is you have to concentrate on the patient and not concentrating on your back or anything else. That has to go into the background. And you can't, because if it comes to the foreground while you're doing a case, it means you're distracted. And doing this stuff, you can't be distracted. Well, it gives me safety 360 degrees. It's comfortable. And I don't have to be concerned about my back doing long cases. It's a winner on 3 counts. Honestly, it's really interesting, because I don't take it off unless I have to go to the floor to see patients. So I just leave it on and go from one case to the next, and it actually helps my back more than having it not wearing it. So it's therapeutic. How about that? There you go. It's almost that good.
Oh my goodness.
Good morning. I'm Dr. Gas Pichot. I'm the director of the Cardiac Catheterization Laboratories at the Washington Hospital Center. Our cath lab is very busy clinically and investigationally. We do about 15,000 procedures a year in 10 cath labs. And we're very active in research and teaching. Last year we published 50 papers in peer-reviewed journals and presented numerous abstracts and gave talks and live case transmissions. One of our prime projects is to minimize risk to the personnel in the cath lab, as long as, of course, quality improvement programs for patient safety and so on. But this time I'm going to talk about radiation to the personnel. We've always been very proactive in limiting radiation. The latest addition to radiation protection has been the X-drape. This is a disposable pad that has a 0.275 millimeter equivalent for X-ray protection. And we put it like shown here. There is an area to allow for the femoral sheath. And then we bring it as high as we, once the sheath are in here, we'll move it up. And then we bring this window this way, so it's really only like 1 square or 2 square inch where scatter could still come to the physician. This has been shown by others to decrease scatter exposure to the operator by 50%. We are all enthused about it. We use it on every single patient. Skinny and obese, short and tall. The price is very reasonable, so it does not add significantly to the cost of the procedure. And we are all for safety, as I say. Research at the NIH by one of our fellows, Dr. Maria Pinto, and her husband, showed very clearly the effectiveness of this system to decrease radiation. And they studied it as a pad under the patient versus a pad over the patient versus both. In lieu of that knowledge that we developed with the company, we ARCO this pad, which is longer than the original one. And why did we want it longer? We wanted to fall on the side of the patient, because that's where the scaters come to the operator, as opposed to be just on top of the patient. So this is almost a wraparound, but it really doesn't go underneath. We don't need it underneath, nothing is coming through. Another advantage is, for some reason, you need to visualize the proximal vessels of the leg. Even when scrubbed, this is very easy to move up and down. It has these little straps, so you can attach it. They're sticky straps, which allow you to stick it to the towels. At any rate, very simple, very effective. It should become a gold standard in all cath labs.